Hopes that families will be reunited at Easter have suffered a major blow as government scientists demanded a cautious route out of lockdown.
Advisors are urging the Prime Minister to keep the brakes on for at least another 2 months, and some NHS bosses have even cautioned against reopening schools on March 8.
Boris Johnson is determined for pupils to go back to classrooms on this date, but it could be several weeks before other restrictions begin to be lifted. It means Easter holiday plans may still be ruined, with a government source yesterday warning it was too early to think about holidays, which will not be possible until infection numbers are at much lower levels.
The chair of the NHS Confederation Lord Adebowale said this morning the health service was on its knees and urged ministers to adopt extreme caution in any easing of restrictions.
But in a boost for lockdown-weary Britons, pubs and restaurants are believed to get the green light to start serving outdoors.
It came as
up to a quarter of hospital patients with coronavirus at the start of the pandemic may have been infected while there, figures suggest. The stark figures are an estimate for the period from the start of February last year to the end of July, which makes assumptions about cases from a time when COVID testing was often limited. The document containing them concludes that the impact on illness and death from coronavirus picked up in hospital may have been high, even though these infections are thought to have made up approximately 1% of total case numbers.
This is because many who were already in hospital may have been frail before infection. Researchers from Public Health England and a London School of Hygiene and Tropical Medicine came to the conclusions after examining 2 sets of data.
But Professor Stephen Powis, NHS National Medical Director, disagreed with the speculative claims.
On the current rate of reduction in COVID cases, official scientific advisors think it is likely to take until the start of May for numbers to come down low enough to consider easing restrictions. Government scientists are sticking to the mantra the lower the better and are likely to push for infections to be at similar levels to June and July last year, when the first lockdown was lifted.
They also believe current travel restrictions reduce the chance of new COVID mutations, such as those found recently in Bristol and Liverpool, being spread around the country.
Officials warned last night that hopes of families being reunited with relatives in different parts of the country at Easter hang in the balance. Whitehall sources said ministers are waiting for more data showing the vaccine's effect on transmission of the virus before deciding if UK-based getaways will be allowed. Downing Street has said the PM will set out his roadmap to lifting lockdown on the week of February 22.